22. While spraying pesticides, a farmer wears long pants, a long-sleeved shirt and gloves. The farmer is trying to prevent contaminants from entering the body by A. Absorption, B. Injection, C. Ingestion, D. Inhalation. The correct answer is A. Absorption. Explanation. When wearing protective clothing like this, the farmer is minimizing skin contact with the pesticide, which is the primary route of absorption for these types of chemicals. 23. Midnight dumpers have been leaving toxic waste in an illegal dump site in the woods. The soil beneath the waste is highly porous. A nearby house has a well, which taps into this porous soil. Based on this limited information, through what medium is the well most likely to become contaminated? A. Soil, B. Air, C. Surface water, D. Groundwater. The correct answer is D. Groundwater. Explanation. The well is most likely to become contaminated through groundwater because the porous soil allows the toxic waste to leach into the groundwater, which the well taps into. 24. You spill a toxic substance. You cough, and your eyes immediately begin to water. You are experiencing what type of exposure? A. Acute, B. Chronic. The correct answer is A. Acute. Explanation. Acute exposure refers to a short-term exposure to a substance, where the symptoms appear immediately or shortly after exposure, like in the scenario described with coughing and watering eyes, upon contact with a toxic spill. 25. You have just learned that a chemical you work with is a teratogen. What effect does this chemical have? A. Increases the risk of cancer. B. Increases the risk of physical defects in a developing embryo. C. Causes a permanent change in the genetic material DNA. D. Irritates the lining of the throat. The correct answer is B. Increases the risk of physical defects in a developing embryo. Explanation. A teratogen is a substance that can interfere with normal fetal development, causing birth defects. Option B best describes this effect, as physical defects in a developing embryo is the defining characteristic of a teratogen. 26. When you are about to have a serious operation, the anesthetist is likely to use a substance which is A. A CNS central nervous system depressant, B. An irritant, C. An asphyxiant, D. A corrosive. The correct answer is A. A CNS central nervous system depressant. Explanation. A CNS depressant slows down brain activity, which is the desired effect during surgery to relax the patient and minimize pain. Perception. 27. Which of these groups would be likely to have the most extreme reaction to most types of toxic exposure? A. Adult women, B. Adult men, C. Children, D. Adolescents. The correct answer is C. Children. Explanation. Children have a higher metabolic rate, smaller body size, and developing organs, making them more susceptible to the effects of toxins compared to adults. They also tend to explore their environment through touch and mouth, leading to increased exposure through ingestion. Additionally, their bodies are still developing and regulating important systems, making them more vulnerable to the disruptive effects of toxic substances. 28. Groundwater is least likely to be contaminated under what circumstances? A. The waste is confined by an aged underground storage tank. B. The groundwater is protected by a relatively impermeable protective layer, such as clay. C. The contaminants are persistent. D. The contaminants are highly soluble. The correct answer is B. The groundwater is protected by a relatively impermeable protective layer, such as clay. Explanation. An impermeable layer, like clay, prevents contaminants from easily seeping into the groundwater, thus minimizing contamination.